Okay, so welcome everyone. We're going to get started. My name's Roxanne Black-Weisheight, and I'll be moderating today. Thank you for joining us for our webinar on breastfeeding benefits for mother and child, presented in collaboration with Robert Wood Johnson University Hospital, Somerset, and Friends Health Connection. The American Academy of Pediatrics recommends that babies are breastfed exclusively for the first 6 months. Breastfeeding offers a variety of health benefits, both physical and emotional, for both mother and child throughout their lifetimes. On today's webinar, we will talk more about those health benefits, as well as tips for getting started and overcoming challenges with breastfeeding, including how to continue breastfeeding when you go back to work. We are joined today by Dora Goodwill, a registered nurse who is Director of Maternity Services at Robert Wood Johnson University Hospital, Somerset, and Nasrin Nikpour, a registered nurse who is also a certified lactation specialist at Robert Wood Johnson University Hospital, Somerset. Thank you to both of you for joining us.
Thank you for having us.
Thank you for having us.
So I'd like to begin by asking you both to tell us a little bit about yourselves and what you do.
My name is Dora Goodwill. I am the Director of Perinatal Services here at Robert Wood Johnson, Somerset. I have been a nurse for 20 plus years, and 19 of those 20 plus years have been in perinatal services. So from the nursery to postpartum to labor and delivery. And I have also been in management for 10 years now and still been at the bedside helping patients with breastfeeding and other needs of the perinatal world.
My name is Nasrin Nikpour. I have been blessed to work as an international board certified lactation consultant for the last 10 years. In addition to my experience with being in OB field for around 30 years now, being a midwife, and then registered nurse, working as a staff nurse, and then earning my certification in lactation. This is something that I really enjoy doing now, and it's very fulfilling to put all those experiences together to help these mothers with helping their babies to breastfeed and be naturally raised.
Wow, thank you for the many lives that you touch and the decades of work that you've done. Thank you, and thank you for being here. So, new mothers are encouraged to start breastfeeding immediately after birth. How do you ensure a good start with breastfeeding?
Actually, when I was thinking of this question that we need to start somewhere to educate our patients, this is one of my favorite ones, because those few hours, those few days, believe me or not, they have a big effect on the whole process of breastfeeding for a year, that or more than a year that our patients are planning to do it. And hopefully a good education, I would say, prenatal breastfeeding education is the key, because when you have knowledge, you empower yourself. And you face better with difficulties and challenges of unknown. So I highly recommend parents to participate in a prenatal breastfeeding class when they're going through the pregnancy period of time. And then definitely after birth, I would recommend, and this is something that we all experience in our hospital, that our patients are being encouraged to do skin to skin. Like, I can't say enough of the skin to skin benefit on growth, on immune system, on breastfeeding promotion. All of this all depends on that skin-to-skin experience that brings a lot of bonding, good start for the babies to naturally do the latch and breastfeed. So if I would say two things that is important is these 2 points, education and practicing skin-to-skin right after birth.
But if the moms are having difficulty, they can always ask for assistance from the staff, or if they're at home, they could reach out to their obstetrician and see if there's any outpatient support they can get. But also, if there's a reason for them that they're not able to immediately breastfeed, such as if the baby's in the NICU, they can hand express and then feed the baby in that way, and then make sure that the baby's been fed. But it's really good to avoid formula, and so this way it prevents that confusion with the nipples. It's best to hand express and finger feed the baby first. You try all those methods. So that's how you ensure that the good start is supported and hopefully enable the baby to continue breastfeeding.
A lot of moms worry that their baby is not getting enough milk. How can you tell?
Oh, wow. I call this a not enough syndrome. So pretty much all mothers at some period of time of their life, they think, or they assume, I should say, that they don't have enough, which is not the reality and truth. Especially at the first few days, the breasts are very soft and is not noticeable. You may express the breast or you look at it and you don't see anything. And if you don't see anything, then you're assuming that you don't have enough. So that's a very challenging worry for parents and especially moms or sometimes other family members. But again, educating the mothers that cholesterol, the best nutrition, the gold food is prepared from 16 weeks of pregnancy. It's in your body, is there. And the baby's mouth is designed how to suck and swallow and breathe and take that drop by drop to fill that little belly that baby needs really to fill in. Like their belly is so small, like a marble size. They don't need that much to eat. They don't need the whole bottle. If you think about it, all they need is 1 spoon, maybe 5 to 7 ml to fill that little belly first day. They're very sleepy. They don't need that much. They can go without eating if there's no complications, actually. So I understand that where they come from, that how they think, and especially in certain cultures, they really jump to that bottle formula first time, first day. And that thinking of not having enough leads them to a poor start, actually. Later on, actually, the mothers are going to see that suck, swallow, breathing, and that signs of, audible or even visible swallows, and then they have a little more assurance. And usually milk comes in between 3 to 5 days. It comes to the volume, and that's when the breast gets larger. And post-feed, they feel that softening of the breast, and that's a good sign for them. They're like, oh yeah, I'm happy. I fed my baby. I have enough now. So those first few days, they really should trust. They should be monitored. Baby's diapers and also weight check is a good tool that we will know if diapers, for example, every baby has to pee and poo at least a few times a day by day 6. And also weight gain. They all lose weight. That's another thing that worries the parents, because why my baby's losing weight? It's normal. They should lose weight because they're not eating as much as they're having diapers. So they all lose weight with breastfeeding. But the key is that milk will come into volume and weight gain is going to happen by 10 days. So these are the things that I think is so simple, but sometimes very hard to understand for mothers. And I don't blame them because I have been there.
I know, just as all this, it's like you're saying, nature will take care of it. Just go with it, right? And
exactly.
As mothers, I think we're internally wired to worry. It's just a natural thing, we just
exactly. We still worry for adult children that we have, don't we?
I know. So how often, for how long do you need to breastfeed?
Well, one of the things we have to remember, one of the rules or term is to breastfeed on demand. It's really important to follow the baby's cues. And, and when they're hungry, they will kind of let you know they might start crying. That usually happens every 2 to 3 hours or so. But it's common to make sure that the babies are fed at least 8 to 12 times a day. If the baby's asleep for a little bit, maybe for 3 to 4 hours and they haven't fed, it's important to wake them up and attempt to feed them. But yeah, that on-demand cue is the most important cue to follow.
Yeah. Sometimes, just to add to this, sometimes parents, they get confused. Some doctors, they tell them 8 feedings a day. Some doctors, they say wake up the baby every 2 to 3 hours. There's no confusion. The big umbrella is on demand. Follow your baby's cues. They eat much better when they are ready for it. And if the baby didn't wake up, then that's a different story. You try, you attempt. It's still, if they don't want to eat, they won't eat. And you got to wait and be patient. Sometimes they have their own rhythm on different days, different babies, different mothers.
When should you introduce the bottle?
Well, early frequent breastfeeding has an important effect on the milk supply. So to avoid nipple confusion, it's encouraged that babies are breastfed for at least 3 weeks to allow them to practice breastfeeding, also the nipples develop a little bit more stronger before you introduce the bottle. It's much easier to go from breastfeeding to bottle feeding than to go from bottle feeding to breastfeeding. Right, Nasrin?
Correct. Once in a while, we have parents that they worry. They say, "Oh, my previous child, I never introduced the bottle early, and then I had trouble because baby was always on me, never received the bottle." But honestly, that is so rare. Like most of the time, problem happens when they do jump to bottle earlier time, and it's always easier to go from breastfeeding to bottle feeding rather than from bottle feeding.
Why is that?
Because their muscles and their all jaw and all those rhythmic sucking, they become stronger by the time they need a couple weeks to get that to strength. And the sucking patterns are so totally different on the breast rather than bottle. The nipple, the artificial nipples are like sucking on a candy. But for breastfeeding, there's a lot of muscles, and tongue has a big role on pulling the nipple in and emptying it. And they become master by this, like exactly like walking, that the baby will get better on walking by practicing it. And if you don't let that happen, then they don't walk well.
That's interesting. Okay. Does the size of your breast matter?
No. Your breast size doesn't affect how much milk you give. Mostly bigger breast has more fatty tissue. And that's the most important piece to the breast is the glandular tissue, because that's what makes and store breast milk. So that's more important. So it doesn't matter what size your breast is. It's more important that you have glandular tissue that will really make and store that breast milk.
Correct.
That's good to know too. What are the benefits of breastfeeding for the baby? We know there's so many, but what are some of them? And how does it affect their health as they grow to teens and adults?
Definitely. The list goes on so big, honestly. If anybody want to Google 101 reason to breastfeed, I know everybody's so highly, educated on the internet now. And once in a while, even though I know that list, still I go review, because every time it gives me a little different flavor to approach different mothers. But few of the favorites that I would list for the babies are the best bonding with mom and baby and the immune system booster that breast milk has. Versus formula that affects negatively on their immune system because it's foreign materials to the body. So to me, those are my favorites: immune system, bonding, but definitely prevention of many diseases on children, infections, GI system, ears and eyes, and eczema, allergy, asthma, everything. These are all research proof that there is no formula comparing with breast milk. And what is the best perfect optimal nutrition by American Academy of Pediatricians? That
breast milk.
Breast milk is the optimal nutrition. And do we all know this? And it still is such a question. Is that okay to give formula to my child? Absolutely is not okay, because our children are not designed to receive formula, which is basically based on cow milk. But again, is parents and mothers' decision how to choose this. But the benefits goes beyond this 101 reason. Like, it's amazing. Breast milk has live cells in it. And those live cells that they attacked all those bacteria and funguses and germs and everything. And they basically seal the gut to protect the babies from many diseases for their future life. Obesity, diabetes.
Yes,
These are proved.
Yeah, they also have higher IQ.
Higher IQs. Yes. That is unbelievable. The list goes on. And baby girls, less breast cancer, less risk of breast cancer. So many things are changed in these babies that they receive exclusively breastfeeding, milk,
And to sum it all up, breastfeeding is free, formula is expensive.
That's a very good point. Easy to use.
Easy to use.
There's no preparation for it. Just
What are the benefits for moms?
Oh, wow. Mothers, they get a lot of benefits on this. Number one, we all know breastfeeding mothers, what? They bleed less because they can be at risk of hemorrhage postpartum. And breastfeeding absolutely promotes the natural hormones to prevent of this excessive bleedings and shrinks the uterus back to normal faster. So basically, the mothers are on less risk of anemia or iron deficiency. Their confidence are boost that yay, they're doing breastfeeding, they're feeding their children. So many of the things, or postpartum depression or any of these things, can just be little bit covered under that love and that bonding connection that they receive through doing this. Absolutely, certain cancers like breast cancer, ovarian, endometrial, all of this can affect, and also is optimal pacing for childhood. Like they can get less frequent pregnant by breastfeeding.
Research on for moms who go through postpartum depression. Is there any research on how breastfeeding affects them?
Actually, on my personal experience, the postpartum depression is very wide. It depends on so many factors that they're really working on it. There is not significant research on this. But usually mothers, they get a little overwhelmed and fatigued and tired at the beginning, especially if there are challenges with breastfeeding. But overall, they have a better confidence at breastfeeding. And honestly, I don't know if there's any current research on this subject, but definitely that would be part of the research that they can work on it.
Yes. How should a mom watch her diet when breastfeeding?
Oh, wow.
Diet. It's important for a mother to eat, nutritiously when they are breastfeeding. Because they burn at least 500 calories when they feed their babies. So it's important for them to eat nutritiously and try to avoid fatty foods, because you have to remember that what you're eating is really what will be converted to what your baby will begin. So it's important to eat healthy. Breastfeeding does help with weight loss. So if you consume more calories than you take out, you might not lose as much weight. But if you consume appropriate amount of calories, healthy calories, you can lose weight. So it does help their diet. If you eat properly, it will optimize your health as well.
So sufficient protein, fruits, vegetables, whole grains, good fats, these are a must. Like it's a mistake to take the whole carb or whole grain out of the diet, because we need that on every single meal. So dieting to lose weight is not appropriate, is not suggested. But definitely eating healthy, better choices, absolutely is a superfood, nutritious. It can boost the milk supply. There are so many patients that they come from different cultures that they come and talk to us, and I learn a lot from them. That, hey, my mother-in-law made soup, chicken soup. I have fenugreek in my food. I have melango, fennel, this and that. So I tell them, go for it. Go for it in moderation. If it's something that historically it's working for your culture, go for it. But if it's in moderation, it's okay. And it's in the shape of a whole food. But if it's a supplement, and if you want to go higher doses, definitely you need to talk to your pediatrician, and definitely is not FDA approved. So you got to be careful, especially with the NICU babies and preemies. You got to be careful with those herbs.
Yeah, okay. And then along those lines, medications.
Yeah.
So is it safe for a mother to take medicine while breastfeeding? And does that, in some cases, nix her ability to breastfeed? What would you say?
Yeah, when we look at the medications, we're looking at two aspects. Does it affect the baby's safety or health? And how does it affect the milk supply? So most of the medications, per our research based on LactMed and medications on mother's milk from Dr. Hale's resource, they're pretty safe. There are so many medications that they're okay to breastfeed with them. Because honestly, if you compare the breast with placenta, everything passes through the placenta, but usually medications, they pass in a very, very, very tiny dose through the barrier of the filter of the breast. So that's a good thing. So especially if the baby was exposed to any medication through the pregnancy, most likely it's safe to breastfeed with that medication. And there are some categories and it's some research in different areas. Most of the medications on their manufacture, they contraindicate the medication on breastfeeding, but that's not true because they have to be safe. They have to be, like in the most safest zone. Most of the time is not a contraindication. I would suggest the patient to go to LactMed to do their own research and talk to the pediatrician and definitely speak to a lactation specialist for more references.
Okay.
And the pharmacist can also guide them because if it's in the pregnancy category B already, then they can further go and speak with their obstetrician.
That absolutely, and pharmacists, Dora, usually they look at the manufacturer's recommendations. So I find it helpful. At least I want to know it, but then I can bring that to attention of the pediatricians that they're observing and monitoring. Most of these medications, all you need to know is monitoring your baby closely for any changes.
Okay. And if a mother cannot breastfeed for one reason or another, I know you said formula doesn't come close. Is there anything that could be done in that case that could help either supplement formula or something, or it just doesn't come close to breastfeeding?
No, unfortunately, most of the time, especially with the psych medications or blood pressure medications, we can give them alternative medications list that they can discuss with their primary doctors or psych doctors or whoever specialist is prescribing that medication.
Okay. Yeah. What are some of the most common challenges that you hear about when moms are breastfeeding?
Oh, that actually is my favorite list of my prenatal breastfeeding classes. I don't want to scare the patients or mothers about these challenges that may happen, but also I kind of like to educate them that they know that there is some challenges. You're going to face these challenges, but don't worry, don't give up. There is a hope on that. So I list them, but please don't give up hope. One of the best that I can say is ask for help, see a lactation consultant, and pump till you can overcome these challenges. But just the listing goes from the beginning. The first day babies are very, very sleepy, and that kind of is very scary to parents that they are thinking that something is wrong with that babies is sleeping. But honestly, there's nothing wrong with those babies. They're just tired as you are, mommy, and they want to sleep. Let it be. Just the babies, they eat a little less on the first 24 hours. And then second day, usually, or first night, I would say, all of a sudden they wake up and they want to eat constantly. And that makes parents very worried that, what am I doing wrong? Is anything wrong? Not enough syndrome kicks in, and they get worried again. So those are normal. And then engorgement happens between 3 to 5 days that milk comes in and breast gets very hard, nipples get flat, babies, they become fussy a little bit. You would think that milk in is a good news, but somehow is a little challenging again. So they go through that phase with hand expression, ice packs, or pumping if they have to. And then besides these that are normal, we may have sore nipples, we may have flat and inverted nipples, we may have tongue ties, lip ties. That are so many of them now. That is another topic for another session. And we have going back to school that is very stressful for these mothers. The anxiety of separation and how to handle this. and we get that to that subject later, but these are the challenges that I think I face with it, and they're hard. I can't lie about it.
I also can get frustrated from difficult latching, because that's another thing. Sometimes the babies just don't latch.
Yeah,
so
we
it
just
takes
don't know
several
why.
tries.
Yeah,
So,
it takes some
you
time.
just have to have a little bit of patience and continue to try. Don't give up.
Mm-hmm.
Are there any tips you would give to that regard? If a baby has trouble latching on, or just keep trying? Bottom line.
Yeah, I would say keep trying it every few hours, but hand express and finger feed the baby.
And you can also try different positions. So sometimes,
Yeah.
depends on which position you use, the baby might latch better.
And to me, skin to skin is the big key. Because let's just say if they have a little bit of trauma on their head and they're just so tired and beat up, what would you like? Comfort, right? So when they go to the breast, sometimes it takes few hours to be getting that trust back again, and that safety, that comfort, that pain relief. And then they start moving and they start doing it. So time is important, and saying no to, please don't jump. Parents, don't jump to formula. That is a very easy fix, but it causes more trouble in the future.
Okay. For moms who are planning to go back to work, what would you say are some tips for these moms?
Oh, wow. I've never experienced this myself personally, but I've worked with them in the support group long enough to know how stressful is that for them. I would say preparation, scheduling your pumping ahead of the time.
Yeah, come up with a schedule that, that you can practice before you go back to work. Determine how often your baby eats. Do you need to pump, and then you pump those amount of times? And also, do you need to have a breast pump? Are you at a work where maybe your baby can come to you, or if you can't, then you need to pump the same frequency as you will breastfeed your baby. So those are some of the things that, planning going back to work. I mean, it's a legal right that every employer should make a space that's private for a mom to pump while they're at work. So those are all the different things you may want to find out. Where do I go to pump while I'm at work? So this way I am able to plan my day accordingly. If I have 15 minutes break, and when do I go? And also, what type of bra, now that I'm not going to be home, what appropriate bra might be comfortable for an 8-hour day or a 10-hour day or a 12-hour day, depending on what, because those are all the things that would help a mom to continue to pump and breastfeed their baby.
Also, I would patient, as you said, the law is protecting them. How do you communicate this with your employer? Just go to them and say, hey, I'm breastfeeding my baby, and that's very important for me. I would like to continue to provide that breast milk for my baby for a while. And they will know. When you say that nicely, they know that they should give you that time and private area to do this. I would sometimes encourage the patients to go and have a practice day. Like, pick a day that you have a babysitter, go to a family member house, pack your stuff, get ready, get the pump, and see how much every step takes time. Like, by actual not dealing with the stress of a return back to work, that makes them feel so good when they have that option. That's one thing I would say. And then ways to clean the pump kit. What is your plan? Are you going to use the microwave bags? Are you going to use the Ziploc bags, simply put them in the refrigerator and reuse it again? Or wipes, make it faster if the time is limited. Depends on what type of environment you have, so plan it ahead of time. And the last thing to say, I'm sorry, I know that we're running out of time perhaps, get a support group information and join a support group. Share your feelings with those mothers that they're struggling with the same thing. You get a lot of tips from them. I did this, I did that. How do you do this one? How do you do that one? And the last to say, your milk supply is going to drop down no matter what when you return back to work, because you're sleeping less, you're dealing with the stress of a new environment again, and you're missing your baby. This milk will come up again. Don't worry. Don't worry. You will work it. It will come up. You need a little more rest on the weekend and a little more pumping during the weekend. And in a few weeks, you will be back to normal again.
Okay, that's great to know. What should people look for in a breast pump?
There are so many of them, and still I'm educating myself. on different brands, and I'm sure I'm not going to bring any name brands here, but depends on what's your budget, what's your need, how frequently you want to pump, how sensitive your nipples are. Read the reviews, I would say, on the internet, and the power, the budget, all of this together. Most insurances, that's the good news, that they're covering for a double electrical personal pump. So that free pump, get it and have it at home before birth. You never know when you are going to need it. Hopefully, if you have more budget, you can upgrade this to what you need, because some insurances, they give the reimbursement to you. The reasons that is just exciting me are those wearable pumps, like, oh, I'm not going to say the names, but they're connected to app, the smartphones. And you pump when you're seeing the patient, you pump when you're washing the dishes. Oh my gosh, I'm jealous on that one. I never had one.
The new technology
Yep.
age, so they've come up with new gadgets for us to pump.
Yep.
How long can breast milk be stored?
So there's usually, depending on the facility, if it's a regular baby, there's the rule of 5. If it's a NICU baby, it's the rule of 4. So it's 5 hours outside, 5 days, or 5 months in the freezer. So, and if it's for a NICU, it's 4 hours for, outside, 4 days, and 4 months in the freezer as well. So those are some of the rules that we maintain based on the CDC guidelines.
Yeah, also in coolers, you can keep them up to 24 hours. In a deep freezer, you can go up to 1 year if you want. But definitely not at the door of the refrigerator or freezer. It has to be in the back of the freezer or refrigerator. And there are 2 websites that I think patients, they can find good resources. I like the Kelly's Mom's website on this. It has a table and it explains everything, and also CCD recommendations, Center for Disease Control and Diseases Prevention, that has a good table to explain all the temperatures, at what temperature, how long. So if it's hard for you to find out how to calculate that, go with the rule of 555 or 444, which is easier.
Thank you. What breastfeeding support do you offer to new moms at Robert Wood Johnson University Hospital, Somerset, and how do people get more information?
So one of the first things we do, we start from prenatally. So we do offer a prenatal class to pregnant moms and dads that can come to that by our lactation counselor, Cecilia. She does those classes, and Nasrin help at times with that. So we do offer prenatal classes. And then at delivery, we do have the prenatal counselor and the prenatal and the lactation consultant, Nasrin, who comes and rounds periodically to help the moms with breastfeeding. All of our nurses are trained to help support the moms in breastfeeding. They've attended the A1 course for breastfeeding and are able to support our moms with breastfeeding. And ultimately, we have the support group that we started last January of 2018 that has been very successful, that Nasrin runs.
Thank you. I love my support group. I can't say enough of it. Patients, they come so desperate, unhappy, unknown answers, and they open up to each other, to me. I'm honored to learn from these new mothers. Every single mom is teaching a lesson to me, honestly, Dora. And then I open up to them. This is what I know. Listen, this is the way to go. Be patient. I'm here for you. And then they come and graduate those babies in a few months or a year. And then they're like, thank you. And the next child, there's no problem. They support each other and we support them. So every Tuesday is a free community service.
That is wonderful. So for more information, is there a website or phone number that people could call to reach your department?
Well, they can call the main hospital number and ask for the maternity department or the labor and delivery unit. Our main hospital number is 908-685-2200, and dial 0 for the operator and ask to be transferred to the maternity department or the labor and delivery department. And one of the staff members there, if you ask for a lactation consultant, they'll take your information and have one get back to you later. Or if you ask to speak with myself, I am the director, and a message will be left if it's off hours, or I will be able to reach back and return your call as well. And Nasrin is also I'm
So
sorry.
it's 908-685-2200. Is that
Correct.
right?
That's
Okay.
correct.
Great. And I think the website is RWJUH.
RWJBH, www.rwjbh.org.
Okay, rwjbh.org.
Forward,
Okay.
forward slash Somerset.
/Somerset. Okay,
Yes.
great.
It's a big system. To get to our site, you have to use that forward slash.
Okay, so rwjbh.org
.org
/Somerset.
Somerset. Correct.
Okay.
We're also on
I would
Facebook.
never remember this.
And we're also on Facebook, RWJBH Somerset, so you can find us there as well.
That's true. That's a good point. Anything final that you'd like people to know?
I mean, just not only about breastfeeding, but Robert Johnson Somerset is that homey community hospital that, you know, we're a small hospital, but we deliver big care to our moms and our babies. We have 24-hour neonatology, we have 24-hour anesthesia, 24-hour OB. So there's support here and staff here to support you to have your baby. Our environment is very homey and very holistic. So it makes it a good place to have a baby. So come try us out. You will not be disappointed.
Thank you for that. And thank you again for joining us. Please remember that the opinions shared here today by the medical experts are not a substitute for medical advice from a physician. If you need a physician, please call 888-724-7123. For more information about Robert Wood Johnson University Hospital, again, visit rwjbh.org /Somerset. Thank you to both of you. And thank you again for the work that you do and the lives that you touch and the information that you provided today.
Thank you for having us. It was a
Have a good
pleasure.
day.
Thank you.
Pleasure for me.